This is a fight between life and death.
Cases of coronavirus, and there have been 121,000.
Millions of students will now have to stay home.
हमेशा अपने चेहरे पर मास्क और पैरों की चप्पल होना बहुत ही जरूरी है।
Hello and welcome. COVID is not just a health crisis, it's a child rights crisis affecting children's lives in all ways imaginable. With lockdowns being relaxed, things will improve but will not get back to normal for a very long time, during which time lives, educations and futures will be lost. The greatest long-term impact of this pandemic will be on our children, with the health, nutrition, immunization, education, mental health and physical safety of our children being severely impacted. COVID-19 has only made a bad situation worse. Without our interventions and investments of ideas, of resources and of heart, these children will have no future. We need to reimagine tomorrow. We need to reimagine our children's future. As we begin this telethon, a reminder, India's Children's Day was on the 14th of November. The world celebrated Children's Day on the 20th of this month. Pranoy Roy and Nidhi Kulpati join me on this very special program.
नमस्कार। तो कोविड हमारी सेहत ही नहीं, हमारे बच्चों के अधिकारों के लिए भी घातक रहा है। इतने लंबे समय चले कोरोना काल में बच्चों की सेहत, शिक्षा, टीकाकरण, मानसिक और शारीरिक सुरक्षा पर भी असर पड़ा। वैक्सीन आने में हालात सामान्य होने में भी बहुत समय भी लग जाएगा। ऐसे में हम सबका दायित्व है कि बच्चों के भविष्य पर ध्यान दें। एनडीटीवी यूनिसेफ के साथ मिलकर इस सोच पर मुहिम चला रहा है, रीइमेजिन आवर चिल्ड्रंस फ्यूचर, ताकि कोविड के कारण उनके टीकाकरण, शिक्षा, पोषण, पानी, सैनिटेशन जैसी सुविधाओं से वो वंचित ना रहे। यूनिसेफ करीब 70 साल से हमारे देश में 17 राज्यों में बच्चों से जुड़े विभिन्न क्षेत्रों में अपनी अनेक योजनाएं चलाता रहा है। लॉकडाउन के पहले चरण में 21 दिन के दौरान यूनिसेफ की हेल्पलाइन को करीब 5 लाख फोन कॉल्स आए, जिसमें बच्चों की मदद के सवाल थे। करीब 898 बच्चों की शादी यानी चाइल्ड मैरिजेस को रोका गया। कई बच्चों का स्कूल छूट गया क्योंकि परिवारों की आमदनी बंद हो गई। लड़कियों को ज्यादा खमियाजा इस समय भुगतना पड़ा। आंगनवाड़ी केंद्र बंद होने के कारण जो अच्छा पोषण जहां पर बच्चों को मिलता था, उनको कम ही मिला। यूनिसेफ ने 4 करोड़ से ज्यादा बच्चों को शिक्षा में सहूलियत के अवसर दिए हैं। तो अब आइए बच्चों को कारगर मदद के लिए आज की इस मुहिम से जुड़ें और योगदान दें।
Thanks Nidhi and Vishnu, and thank all of you, thank everyone for joining us in this very special UNICEF-NDTV telethon focused on the children of our country. Now let's be clear, we're all fighting a war against this particularly dangerous enemy. It's dangerous because we don't fully understand it. We are learning, in fact we're also de-learning every day so much about this unseen enemy. It's been called the most dangerous battle we've all faced since the Second World War. But as we put all our focus into winning this war against the coronavirus, we're forgetting the one section of our society that is perhaps suffering the most, our children. We keep hearing that the virus attacks adults and the elderly, which is absolutely true. But while we focus on helping them in this battle, we tend to overlook that in many, many ways, this crisis is really hitting our children the hardest. For instance, UNICEF, along with the government of India, has every year vaccinated our children against so many different kinds of diseases, from smallpox to polio to cholera, typhoid, and many others, and many other kinds of medications. But now this pandemic war is disrupting normal supply lines, and children are not getting the vaccines they needed. That's just one example. Now, as the pandemic hits the medical system across the country, our smallest children aren't even getting the care and attention they need to save them from diarrhea, from malnutrition. Now, in any war, we all know the regulations of the Geneva Convention, which focuses on children at times of war. We need to remind ourselves that many of the regulations of the Geneva Convention must apply to our children in the war that we are fighting today. For example, the Geneva Convention says, Article 23, that children in times of war must be ensured medicines, food, and clothing. Article 24 of the Geneva Convention says, children that are orphaned or separated from their families must not be left to their own resources. And again, Geneva Convention Article 38 also makes it clear that children must get preferential treatment with regard to food, medicine, and other kinds of protection. This is so important today, and we must remember that our children must be given preference. It is perhaps this one time in our history, this moment, there's no bigger moment in our history than now that to remember our children. It is now in this war against the coronavirus. So please step forward and donate to help UNICEF and NDTV help our children, the children of India, and all our futures. Please step up.